requirements or possible mandated requirements that all employees are under, all healthcare workers would have to be mandated with a vaccine. And so we're looking at that and seeing how much is going to be moving forward. Because if it moves forward in its entirety, we have local manufacturers that will not be able to maintain their workforce. We have 2 hospitals I spoke to. I visited all the hospitals last week. They have ample vaccine supplies and so forth. But 2 of those hospitals mentioned that they lose 20% of their workforce and then 12% of their workforce. So there's a component that we're asking the governor to work with the private sector and to work with the federal government to say, how can we minimize the impact? Because we're already in a workforce crisis in the state of New Hampshire as it is. We don't want to further do that. We understand public health is critical, but we're trying to work those issues through. So those are really the 3 things that would be in the joint resolution between the governor and the council. We're working out the details as we speak. And if it works out, then that funding would be released to where it needs to go. So, but I've had good conversations with the hospital leadership and with the regional clinics that I've spoken to, Amanuense and COAS Family Health. So we've had good dialogue. We're just trying to get to a point where the council feels comfortable.
Joe, I read that the governor withdrew the $27 million.
He can bring it back.
So that's not an issue. You're confident you can get that money back?
Well, it wouldn't be 27. It would be 27 minus 4.7. So it would be. So the issue really is the governor can bring anything back. He's Lazarus. He can bring any contract back if he chooses to. But he has to understand there's a support on the council. So if there's support on the council, then he'll say, okay, we negotiate in the back. We'll agree to it, and then we'll bring it back. The issue really, from my standpoint, was that I wanted to mitigate the language, and the governor didn't want to listen to us. And so I'm not going to, he can speak for himself, but for me personally, I just need the language to be mitigated, and I would support the funding. So the fiscal committee has done its work. The council needs to do its work on Wednesday. So that's where we're at right now with it. Okay, but I appreciate your engagement.
Specifically, are you trying
Well, it has to do, if we took money, the federal government would tell the state of New Hampshire, you have to isolate and quarantine.
The General said that's not true.
Well, I don't know if it's not true or whatever, but they need to cut that language out. Because that's concerning.
That's not in the language.
Well, I'm not going to argue. I'm just kind of giving you an update of what's happening. Because with the case of seatbelts, do we have a seatbelt requirement in New Hampshire?
Yes, and we are the last state that had it in New England, and the reason we did not have it was because of the fear of mandated. The only reason we have it is because DOT.
Yes, for 16 and under.
Because DOT said if
Not
you
for
do
adults,
not
so.
have that, you will not get DOT funding. And we weren't willing to turn down DOT funding, so we took mandates. But you're willing to turn this down.
Well, I'm going to say that we lost some money along the way with DOT because there was not, we weren't accepting the adult mandate for safety. But anyway, that's where we're at, working forward with progress, okay?
Well,
Are you going to vote for it?
Yes, absolutely.
Joe,
I'm the one who's putting it
you
together.
understand that mandates come because the people who are proposing the mandates want to keep people healthy and safe. You understand that?
Well, it goes both ways. I'm just saying this council, that's their perception right now. We're working through these issues. I mean, that's the whole part of it. The governor, the only reason why you have a council, otherwise you might as well not have a council, is from time to time is to keep the governor in check and say, listen, we have concerns, okay? Because otherwise you'll have a royal governor, you won't have a lieutenant governor, you'll just have one person making decisions for everybody. So that's why a council exists, to push back when it feels it needs to.
But I think, Joe, the message you need to get from us, loud and clear, is that we were aghast that our state refused $27 million in free money that would have ramped up the vaccination program.
There's no such thing as free money.
Well, okay, federal money.
29
That would have ramped up the vaccine effort at a time when our kids especially are more vulnerable to this disease.
So we
And the
do-
vaccine is gonna open up to those
Yeah,
children,
so
and
we-
we need the money. Hospitals are struggling.
So we know that,
Financially,
the
to do
next
this.
few weeks, hopefully, that the FDA will approve the booster shot. If I talk to healthcare professionals,
They've already approved the boosters.
those are the resources that they're gonna need, okay? So we're gonna have that discussion.
It also makes it difficult for private companies who want to have mandates, their own private mandates, if the state isn't, and the government isn't behind them. So restaurants, all these places that are requiring people to wear masks to reduce the pandemic, it makes it more difficult for them if the state isn't behind them and accepting the money and the mandates, there's a reason for them.
No, your points are well taken. You know, I've got 15,000, if I've been told and counting, people in this state who really feel that their vaccine choice is being taken away from them.
It's too bad.
And they're
They're a
growing.
risk to the public health.
You know.
And the Supreme Court has clearly stated that in a public health emergency, the government has the right to require people to be
Right. The only issue is technically the emergency ended in March of this year.
What? Oh, the technical emergency. The case numbers are rising. Hospitals are filling up.
We have to,
People are dying.
we have to
Mayoral
respond. We have to respond.
candidates are dying.
Yeah, we have to respond. There's no doubt
Comfortable
about that.
standing there without a
But
mask.
remember,
Really?
it is,
Look around, we all have masks.
I have a mask in my car.
Well, that doesn't
That's not
mean
helping
You know where I was, I had to speak to the whole meeting. And so, but the whole point is the governor and the council have to work together, okay? Just like the governor has to work with the fiscal committee.
Council has to listen to their constituents.
I'm hearing impaired, so I play things later so I don't miss this. Seriously.
And we have to
See
work
hearing aids?
with, the governor has to work with the legislature, the House, and the Senate.
So you're saying
okay?
15,000 people avoid the vaccine
And growing.
out of 135 million? I
Well,
mean,
I'm not gonna
1,350,000.
the numbers, I'm just saying that if the governor, and I'll leave it there, had listened to other voices, we would have come to the table, and we're coming to the table, and we're gonna resolve those differences.
We need the
okay?
vaccine.
Well, we have the vaccine, do you not have access to the vaccine?
I have access, but there are a lot of people in the rural counties where you serve that are not getting access
I
because
helped hundreds and hundreds of people get vaccines
we
earlier
need
this
more
year.
people out there
And
putting the
if
shots.
if
into
people
People are
need a
needing
vaccine
boosters
and they're
now.
not getting it, call my office.
Boosters are necessary. This is going to increase the need of assistance of people that the $27 million is going to pay for to get these vaccines into people's arms. We need that money.
Part of it was aimed at outreach to get people who aren't yet vaccinated into being vaccinated. And I
There are
think
people who will never get
I
vaccinated.
understand
Yeah,
that.
but only if you're talking only 15,000, that's a fraction of the
No, that's
population.
just one list. It's growing.
But
I'm
it
just
does
saying
say-
that voices on all sides of this issue need to be heard.
Well,
That's all I'm saying.
if you want to talk about perception, though, Joe, my perception is that the executive council was hijacked by a bunch of loud, angry, fringe demonstrators. And you cowed to them. That's the way it looks to the
No,
public.
because those people I have voted against before, and they were in the room as
I'm
well
just
on
telling
other
you how it
topics,
looks.
so
It looks like they went in, they busted up your meeting, and so you did what they wanted. That's what it looks like.
No, it doesn't, from my opinion.
Yes, it does.
Because I have voted against many of their ideas and thoughts.
Well, you know, that-
And the other thing too is that I will agree that there needs to be more, civic decorum, and that's a breakdown that I've seen in my lifetime.
Yeah.
And we need to get back to, working together. But you do need to listen to other voices. You can't just dismiss them. Right.
I've listened to them. They're wrong.
If you follow the science, the government has to be the adult in the room, if you follow the science.
Right.
They're not, the
It's
hospitals are
it's like the new
begging.
booster shot. When I talk to medical doctors, they say 90% of it works. There's 10% that doesn't. So, I mean, that's the odds that you're
But it's the people who are
given.
unvaccinated that are harming the people who are vaccinated.
What's that?
The people who are unvaccinated are potentially harming the people who are vaccinated, because people who are vaccinated can still get it from people who are unvaccinated.
Yeah, I mean, everyone has your thoughts on it, you know,
The unvaccinated
That's
are
a
the people in the
science.
hospital and who are dying.
That's a science. I'm
You know, it's
making
not
this
like,
up.
There are
I'm
vaccinated
not-
people that
I'm
are
not a
dying.
doctor. What I'm simply saying, it's based off your immune system.
no, it's not based on your immune
If
system.
you have a weak immune system, okay, the chances are not very good with COVID.
That too. But even if you have a normal immune system and you are potentially able to get the virus from someone who's unvaccinated, they're not only protecting themselves, they're protecting other people too.
Well, I can give you an example. Just last week, talking to a selectman in the eastern part of this district, said he's known 6 people that were vaccinated and they still got COVID.
Yes, what are the
And they're getting it from the
What are the statistics? How many of those people are in the hospital? What percentage of the people dying are vaccinated? You can always pick out, oh yeah, I had a cousin whose friend's
But
brother.
that
I
goes
know
back to
5
my original
people.
point, which is I have to listen to all voices.
You know, all voices are not equal. I'm sorry. I'm sorry. All voices are not equal when you are talking about science.
science.
What I'm-
Science is a kind of key
What
word.
I'm trying to say to you is that I, as a representative, I have to listen to all
You don't
voices.
listen to me about anything.
About what?
Let's start with Planned Parenthood.
Well, I
Let's
told
start
you I
with $27
supported-
million.
I
Let's
supported
start with,
5 out of those 8 contracts. 5 out of those 8 contracts.
what was wrong with the other 3?
The other 3, because of the new law that was passed, which you probably read by now, haven't you?
Yes.
Okay, and you understand that unless I have financial records and fiscal segregation, there's no way I know what's going on in those facilities.
Funny, you're listening to those other people,
No, I'm
but you're
listening-
not
I'm looking
listening
at
to
the
the
law.
people who
Looking at
have
the
other
law.
information.
Looking at the law. I mean, it's black and white.
I wish you were my